Hello, John Moeller here. Many of you know me as John from CareFlight, and I've got a little different hat on today in that the Nevada POLST program approached CareFlight and asked if we would help push out some training in regard to the Nevada POLST program and the POLST form. POLST stands for Physician Orders for Life-Sustaining Treatment, and though not a new program, Oregon incepting its program in 1991, we've been working to bring it to fruition for over 15 years, and it's finally happened. So the POLST program is out and in place. It's the hot pink papers found on a patient's refrigerator. And we'd like to get the word out and provide some very quick training. So again, Nevada POLST and CareFlight are reaching out. This video PowerPoint presentation, should take less than 25 minutes, and we'll introduce you to the concept of POLST. So let's get started. We wanted to share with you how you would interact as an EMS provider with a patient with a Nevada POLST form. POLST stands for Physician Orders for Life-Sustaining Treatment and is not a new concept. Regionally, Oregon has had their program in place since 1991, and the concept has been a vision of Sally Hardwick to implement statewide for over 15 years, and the Nevada POLST program came to fruition in 2014, and Sally currently serves as the chair of Nevada POLST, a Nevada nonprofit. So POLST are vastly different than advanced directives, and this is what we wanted to explain and share. The difference between a POLST form and other advanced directives is that this is not just a form, rather it's a program involving a discussion between providers and their patients, and most importantly, coordination between facilities and emergency medical services. It's intended for the frail, the elderly, or those with serious advanced progressive disease and with less than a 5-year life expectancy. It should reflect the current state of health of the patient, and most importantly, it's actually a medical order, physician's order, that travels with the patient from home during transport to another facility. And most importantly also, it provides for an out-of-hospital do not resuscitate, whether it be in the patient's residence or during transport, and can be honored by emergency medical services. Nevada POLST is a non-profit formed specifically to educate and train the public and healthcare providers regarding the Nevada POLST program. Also to provide state-approved Nevada POLST forms, which are printed on bright pink cardstock to physicians. And if anybody should ask about the POLST forms, you can refer them either to their physician or to our website, nevadapolst.org, for further discussion. And thirdly, to support other organizations in providing compassionate end-of-life care. And again, the big advantage to the POLST over an advanced directive being that the POLST form is concise and precise with specific medical orders that allow EMS to honor a patient's wishes, in contrast to an advanced directive which only provide general guidelines and specifics and are often very vague. Plus, the advanced directives are typically difficult to locate, too long and cumbersome for us to peruse on scene. The one nice thing about POLST and its intent was to be portable, state to state, facility to facility, from somebody's home in transport, and that brings us to the trilogy of ask and tell. Facilities need to ask the patient, do they have or want a POLST in place, and then relay that information to subsequent providers. As EMS providers, we want to ask these facilities, does this patient have a POLST form? Take that POLST form, I'm going to say that 4 or 5 times through this presentation, take the form with you and again tell subsequent providers or clinicians that they have an active POLST in place. The form is, again, a 2-page form, typically and ideally done on hot pink cardstock, but that, as you'll see, is not an absolute requirement. It's just a preference for Nevada POLST. And on side 1 is the medical orders, but one of 2 signatures is found here: the physician's signature and date. At the bottom, section C, so this is an important place to look for EMS. And on the second page, the second signature is in section F, and this is the signature of the patient or their legal representation. At the top of page 1 is some basic patient information, like their name, also their date of birth, and the last 4 of their social security number, as well as gender. Note that the birth date is unconventional on our form in that it's the day of the month, then the year. And this probably needs to be clarified with the patient to their actual date, and we recommend that you actually spell it out, so write it in after you confer with the patient. Below that is section A, and this is after you've looked for signatures on both sides of the paper, is the next place to look. Very important for EMS. This is where you see to attempt resuscitation or allow for natural death. One checkbox or the other. If attempt resuscitation is checked, then start CPR. After you've started CPR, then you can refer to section B for further instruction. Remember that if the patient has an EMS DNR number, like on that salmon card, that this is no longer necessary, and that the legislature in 2013 approved POLST to be honored in all settings. Section B becomes relevant if in section A attempt resuscitation was marked or the patient is not in cardiopulmonary arrest. If section B is checked and relevant, then the patient should remain at that current location, whether it be their home, nursing home, any facility, etc., unless, of course, comfort measures cannot be achieved at that location, and then a discussion could ensue as to the best location for that patient to receive their wishes. Section B also talks about limited medical intervention for the patient who is not in cardiopulmonary arrest. You need to look at this, and there's sort of 3 check boxes that are very pertinent to EMS. No IV fluids, no antiarrhythmic drugs, or no IV. And if you have a no IV check, make sure that A and B in the previous sections or boxes are also checked. If transporting, take the POLST with the patient. Again, that's the portability and the beauty of this form, is take the copy with you. Copy or the original. If full treatment was checked, then treat and transport as normal. And again, take the form with you. On section C is a physician validation. This is required. So again, section C on page 1, section F on back need to have signatures and dates. So we're talking section C, physician signature and date. And again, we're going to beat it to death. Take the form with you regardless of destination and provide to the receiving facility. On side 2, in section E, if you have an advance directive which is registered with the Secretary of State, which would be done at the livingwilllockbox.com, the patient may have an ID card available and may also be accessed by their name and birth date. So check this section for durable power of authority. parent of a minor guardian, or whatever, because these folks can override a POLST. No other person can. So this is an important section to check as well. Again, signatures, you need the patient or someone with a durable power of attorney, the parent of a minor, or a legal guardian of an individual must have signed and dated this first line for the entire form to be valid. So again, we're looking for two signatures. Page 1, the physician's signature and date, and on page 2, section F, the patient or appropriate representative providing a signature and date. And these, again, are the only people that can override a valid POLST. Question sometimes comes up, what if the patient has a valid POLST and the durable power of attorney wants the patient resuscitated? Unless that family member can establish that they are the durable power of attorney per the patient's advance directive, then it cannot be overridden. If indeed they are the durable power of attorney and can prove that, then it's best to explain that the patient discussed the form with their doctor, understood the implications of their decision at that time, and had made an informed decision, and ask if that durable power of attorney acting on their behalf are really comfortable overriding one of the last decisions that patient ever made. What if the patient has a valid POLST form and the family wants the patient resuscitated? Unless that family member can establish they are the durable power of attorney, again, per their advance directive, then they do not have the authority to override. Explain that the patient discussed the form with their doctor, understood the implications of their decisions, and made an informed decision. And understand that when the patient completes the form, they can ask for more or less treatment. The choice was or is theirs. You may have to explain what the likely outcome of overriding the patient's decision would be. Section G on page 2, referring to the registry, is a little known site at the Secretary of State's website called thelivingwilllockbox.com, and is a unique site or repository for a patient's advance directive and or POLST, and it's accessible to healthcare providers 24/7. You as a service should be registered to access to the livingwilllockbox.com. A little process to do that, but once that's set up, you have access to the patient's advance directive or POLST, assuming or presuming that they have registered at the site. And their information, these forms can be accessed by the patient's name and their birthday, or their registration number, which they received in their card when they registered at this site. So if a patient indicates that they think they have registered with the Secretary of State at livingwilllockbox.com, then check their wallet for this registration number. Again, these are legal forms. POLST is a state-approved form through the legislature in 2013. An approved form will always have the same content as you'll see on the next slide. And again, ideally it's printed on bright pink cardstock, but other colors or no color, copies, faxes, or electronic versions are valid if appropriately signed and dated. So this again is the form, and the first place you want to check, and probably a toss-up, you can do them very quickly though, Section A and Section C, or reverse that. But again, do they want CPR attempted or natural death? But just as importantly, if not even more importantly, do they have a valid signature? Again, we're going to need two signatures. We're going to need the physician's signature and date on side 1, and then on side 2, the patient or the representative signature. So side 1 is going to get you started quickly. Look at the back side for the patient's signature again for validity. And again, cardiopulmonary resuscitation, yes or no. If no, then you're going to go, or if the patient's not in cardiac arrest, look to Section B for what limited treatment the patient may desire. And again, if they do have no IV checked, make sure that it's in agreement with A and B in that Section 2, and they're consistent with that. And again, the physician's signature and date. On side 2, again, make sure that the signature and date at the top of Section F, which is the patient or their legal representation, has signed and dated it. When it comes to this form and what you do with this form, you cannot be disciplined or face legal action if 1. Treatment is withheld in compliance with the POLST form and the medical orders reflected on it, or 2. The provider is unaware of the existence of a POLST, or 3. The patient, their agent, parent, or legal guardian overrides it. Any of these may override a POLST form. Healthcare providers shall comply with a valid POLST regardless of whether the physician who signed the POLST has authority during the transport. So again, this goes with the portability of it. Doesn't matter what state, doesn't matter what county, doesn't matter what physician currently is involved. If the physician has a valid signature on it, it is good. When it comes to conflicting documents, should you have an advance directive and a POLST which are in conflict, then the most recent one will be considered valid. If a patient has a POLST that directs CPR is not to be provided, but also has a valid DNR identification on their person, then CPR shall not be provided if the DNR ID, again, is with that patient, regardless of whether the POLST is more recent or not. So in other words, the DNR ID trumps the POLST form if they are in conflict regardless of the dates. Again, the DNR ID in possession of the patient trumps the POLST form. Should a healthcare provider, you, be unwilling to comply with the directives of a POLST, all reasonable measures shall be taken to transfer to another provider so that the POLST directive can be carried out. And if a patient is known to be pregnant, so long as it is probable that the fetus will develop to a point of live birth with application of life-sustaining treatment, then life-sustaining measures shall be attempted. If you had questions about blank sections or other states' POLST forms, it's pretty simple in that any completed section is valid unless the POLST is not signed and dated appropriately. So in Section C, you need the physician's signature and date, and then in Section F is the patient or the patient's representative signature, to make the form valid. Blank sections in general are presumed to indicate full treatment unless it conflicts with a completed section. And POLST forms from other states are all different with different names, like MOST, POST, MOLST, COLST, etc. But all have a similar format and use brightly colored, albeit not necessarily bright pink like Nevada's color. But again, bottom line is that any valid POLST from another state, called by whatever name, shall be honored here in Nevada. Bottom line, if any immediate family member is intent on resuscitation, or you do not have either a form in hand or one not signed and dated in Section C and signed and dated on the first line of Section F, then you begin the resuscitation. You can make base station contact like you normally would have done in the past, whatever, but start the resuscitation. In a court of law, it's going to always be easier to defend doing something than it is to defend doing nothing. Interestingly enough, a lot of research has been done on this topic, and fairly recently, more patients who complete a POLST choose comfort measures only, and those with a POLST form for comfort measures only are significantly less likely to die in a hospital. than those who have full treatment, which are more likely to die in the hospital than those without a POLST. And if you look at this, this actually holds true for each of the top 10 causes of death in our patients. Bottom line, end-of-life preferences as documented in the POLST orders are honored. POLST works. And in conclusion, we'd like to remind you that Nevada POLST is a nonprofit formed specifically to educate and train the public and healthcare providers regarding the Nevada POLST program. Also to provide state-approved Nevada POLST forms to statewide physicians, and to support other organizations in providing compassionate end-of-life care. Again, we want to thank you for taking the time to listen to this little program, and we hope you get out there and share this information. And we are indeed looking for trainers and donors to support this entirely volunteer effort. So please contact Sally Hardwick or access our website at www.nevadapolst.org.